You're listening to What's on Your Mind right here on WMBS Uniontown and South Union Township Network. This is Mark Rafel. We are being brought to you in part by Caldwell Banker, Laurel Ridge Realty, Chestnut Ridge Counseling, Davis & Davis Attorneys at Law, Southwestern Gastrointestinal Specialists, Mountain Creek Construction, System Pre-Owned Vehicles, Baker Chiropractic, Jacqueline's Fine Jewelers, My Tree Medical, and also the Uniontown Hospital and some other fine folks you'll hear from throughout the show. We are here today in the studio. As some people know, I'm not normally on here, but I came here. I'm not working for the city today. I took the day off, and I am here. Hey, when it's this important, and not because you're here, but because of the conversation.
Right.
We are going to be talking about COVID-19 with the Uniontown Hospital. Our first hour, we have Josh Kryzak, the Director of Community Relations of the Uniontown Hospital. You know, that's funny because I don't think I've ever introduced you as Director of Community Relations because...
My sidekick, my partner in crime.
My buddy here, you know, and that's how it all...
Right.
But this is very serious. So,
very serious.
Josh, we're going to talk about the overview of the pandemic, the overcoming of fears and the anxieties, the local ramifications, and I really want to talk about myths and facts, too.
Absolutely.
Because I'm really tired of reading on Facebook or social media the myths that you hear, and it's some of them are just insane.
Sure. No, so as you suggested, and just so everyone knows, we are here in the WMBS studio, but we are maintaining our nice distance. Mark's about 6 feet away, so we are social distancing as is appropriate at this time.
Exactly right.
It is, Mark and I often have a lot of fun together, and we still will do that moving forward. That being said, today's conversation for the next couple of hours is significant and serious. I think that what has transpired over the last few weeks in all of our lives is unlike anything we've ever lived through. It has invoked a lot of fear, anxiety, trepidation, concern, and a lot of it is justified. It's something that we've never experienced and gone through. So working at Uniontown Hospital, being involved with our leadership, getting together every single day as we've planned for this, taking precautions, moved through all the steps that we've done, it's quite a challenge. And we are on the front lines, but the key and the most important thing is we're here to keep our patients safe, to treat and care for them, to treat and care for our community, and to keep our employees safe. That is our goal every single day. It wouldn't matter what the challenge was, be it a pandemic, be it a natural disaster, no matter what, we are focused and we are dedicated and committed to those things. So I think it's important that the community knows that we are here for them. We are making sure that we're taking all the steps necessary to keep them safe and do everything we can to provide the care that they need in this challenging time.
I think one of the other things that you didn't touch on was to keep the community informed, because there's so much. I know the city of Uniontown, I'm getting emails and calls about it, and thank goodness you and I are friends enough that, because I know how busy you are, but it's nice to be able to send you a text and say, can you answer this question? Because
Sure.
I don't know the answer. And it's not because I'm not educated. It's just this is such a fluid and constant changing information.
Yes.
I mean, we're getting, from the state, I'm getting emails 20, 30 times a day.
Absolutely.
And it's insane to see the first email to the last email. What they told me in the first email is now totally gone. And we're now into something different.
And that's the challenge we're facing. So our leadership, we're meeting every day, and it's a standing meeting, and they run long, as you might expect. But that meeting, we cover everything, and the things that change from day to day is unbelievable. It often, things can change even in an hour, and that runs the gambit of what you could consider changing. You know, what's the best protocol for this? What's the best protocol for that? So that fluid nature of it certainly adds an additional layer to what is a national emergency.
Well, and I'm going to just start. Let's talk about the steps that the Uniontown Hospital has made. I know in the beginning, when it was first coming out,
right,
out in the Asian countries and out in Europe, there was really, you guys were on it, but there was no restrictions for visitations. There was no concern about don't come to the ER if you just have a cough. You know,
Right.
But and now, today, what are the
Yeah.
let's start with the visitation policy.
Yeah, so we'll start there. So what we did, and you're right, as this has evolved, we continue to monitor and watch everything, and we continue to meet, talk about best practices, have plans and protocols in place. One of the very first things we did from a public perspective, and everything we do is through coordination with the CDC and with the Department of Health. We're in touch with them on a regular daily basis, getting guidance, seeking guidance, finding best practices. But we decided last week that we had to suspend our visitation policy. So that was the first big significant step. And as you've seen with the numbers, things are continuing to ramp up quite quickly, not just in Pennsylvania, but all across the country. Our numbers are spiking as more and more tests are administered. So we closed inpatient visitation completely the middle of last week. That was to protect our patients, to protect our staff. We want to do everything we can, just as all citizens are, to mitigate any potential spread. And there's no place that you want just any type of germ floating or coming in with somebody unknown than the hospital. That's the place you want to keep as clean as possible and care for the people that are there.
One of the things with COVID-19 is it affects everyone, but if you have a weaker immune system, it affects you more.
Absolutely. So that's the challenge. And it was not a decision we took lightly. Having visitation and having people in rooms, spending time with patients is an important part of the recovery process. So we did a lot of things. We encourage our patients that we do have and inpatients to maintain contact in other ways through FaceTime and things of that nature, repeated telephone calls, emailing, texting. All those connections to your family help you recover. We recognize that, and that's why it was a difficult decision to make. But at looking back on it now, 1 week removed, it was definitely what needed to be done. I'm glad that we did it, and it was just a first step of what is now continuing to be kind of a domino effect as things are happening. More and more protocols are going into place. So I'll let you know and all of our listeners know, for a long time, as we watched the numbers spike around the country and even in the state, Fayette maintained that zero until a few days ago. We had some of our first cases. Those cases did not have a specific link to Uniontown Hospital, those first two. But I can confirm as of today, we have tested 3 positives.
At your facility?
At our facility in a variety of ways. One was a patient tested in the ED. One was a patient tested at our drive-through facility, which we'll talk about later on, and one is an inpatient that we're still caring for. So we have had 3 positives, and I think that was really a turning point for us. The specifics of those cases, that's not something we're going to get into, and I know.
I don't think we need to. I mean,
right.
It doesn't matter who.
No.
Or where. It matters. It's here.
Right.
We all know that.
Right.
And now the next step is when they're diagnosed. When they're diagnosed, then they have to there's questions that the CDC gives you guys to ask them, which is, where were you for the last 14 days? Tell us everywhere you were, not just were you out of the country. What places did you go?
Right. So we're following all those protocols, tracking back, doing all the proper steps. And I think that the key thing that people need to know is we've been prepared and have known this day was coming. And as it has arrived, it was not a shock to us. We had protocols and precautions in place. We feel very confident that in all of these cases, there was no additional exposures because people were following the protocols we had in place to conduct testing and to provide care. And, there's a lot of things that happen on the inside of the hospital to keep our patients safe and our caregivers safe on a daily basis, even when COVID's not part of it. And that's following a lot of guidelines and a lot of different areas to make sure that exposure is not happening. So I think it's important that the public knows that it is here. We are prepared. We are dealing with it. We're ready to continue to deal with it and take care of our patients, and we feel confident that we have the processes in place to make sure everyone's safe.
So as of right now, 125 on Wednesday the 25th, you're telling us that there is a confirmed 5 total in Fayette County.
That's correct.
Okay.
Yeah, I believe the last I saw, the Department of Health number was 4, but there is 5.
Let me ask this, Josh, before we get too deep into the next subject. I know that an agreement was signed with WVU Medical. Is that helping you guys, your leadership team, because you now have the expertise of even more infectious doctors than you have on staff?
Sure. So, yeah.
If I said it the right way, because
You said it sort of the right
I'm
way.
trying to.
You're good, man. You're good. So,
I'm getting back on that bike.
I know you are. I know. So, yeah, you're going to get to hear in the second hour, we're going to have a special guest, our Chief Medical Officer, Dr. Serby Gower. She's going to join us. And also, we consult regularly with our own infectious disease expert, Dr. Jeffrey James. Those two have taken the reins and have been involved in numerous high-level discussions and decisions around how best to care for the community. And they're doing an exceptional job. But you're absolutely right. Our forging of a partnership and a new relationship with WVU that is continuing to develop, and we're still moving in that direction, and we still don't, still pieces need to be finalized. But having those contacts, those connections, and getting a chance to utilize their experts and discuss things with them about best practices and seeing how they're handling things like how to protect their staff or what to do in certain instances is certainly things that our leadership teams are then reflecting upon and helping to develop what we're doing. And having that, it has been a great addition. There's no question. Well,
something that you mentioned in the beginning, in the middle of this conversation, you talked about how you guys are always preparing. So, and I'm gonna, in my observation, 10 years ago when you go to the Uniontown Hospital, there were no hand sanitizing devices every 12 feet or 14 feet now.
There's a lot,
and that's where and it's not like you added more now.
Right. No.
Those have been there for the last 3 to 5 years because you guys are constantly looking at ways to create safety and keep a healthy environment because you know what's there. Right. There's disease there. There's sickness there.
That's right. So whether it's a normal year, like when the flu spikes and we're trying to keep the flu numbers down, it's the same concept. So those hand sanitizing stations are there. The same protocols that are taken by our entire environmental services staff. All those things are still in effect, and now they've been ramped up even more to maintain, as best we can, a safe and clean environment. We have staff that are now routinely just kind of roaming the halls, and wiping down any high touch point surfaces on a regular basis. There's additional carts placed throughout the hospital in various places with cleaning supplies on them. People can wipe things down. We have gloves that are available on the wall. If there's a piece of trash or something like that, people can pick them up with a glove and not have to touch anything. Anything that we can do to help maintain that, we're doing it. There's no question.
So let's talk about elective surgeries.
Yeah.
How many of those happening now in the Uniontown Hospital?
That would be 0. So we followed the state order and orders around the country. We have eliminated elective surgical procedures at this time, and it's really threefold. We want to protect the staff and patients from potential exposure. We want to conserve, our personal protective equipment and gear needed by our teams if and when there's a surge related to COVID. And as you know, one of the hot button topics that's out there is the masks and the PPE, as we call it. And it really all gets back to those same kinds of things. What can we safely say you can get this done in a few months when this calms down?
Right.
We need to, and the final part of the 3-prong was we need to reserve space because we don't know what that surge might look like. We talk about that curve and flattening the curve, and the public understands it to some degree, and that's why social distancing is happening and those sorts of things. But that curve is especially frightening and poignant when you're in a healthcare setting, when you're thinking about that and what that might look like if you have a large number of people that suddenly need emergent care and or inpatient care at an ICU-like level. You have to have bed capacity. You have to have capacity to care for them. So we're willing and we're in agreement with the federal government and state government saying, yes, we'll suspend these things to make sure that we have the beds to care for patients when they need it.
All right, so we're going to take a quick commercial break.
All right.
We come back. I want to keep on that conversation of elective surgeries because I want to ask a couple questions about that.
Okay.
We'll be back after these messages. You're listening to What's on Your Mind right here on WMBS Uniontown.
WMBS.
You're listening to What's on Your Mind right here on WMBS Uniontown and also South Union Township Network. And we are here talking with Josh Kryzak from the Uniontown Hospital. And if you don't know what we're talking about, you really are staying in your house. I'm just saying.
And even so, then you're not listening to the radio, watching
you have
TV.
no television. Yeah, you're way off the grid.
Yeah, exactly.
So we are talking COVID-19, also known as the coronavirus. I kind of like COVID-19 a lot better than the coronavirus. It just...
We did talk about that too. Actually, both of them have a ring to it. They're easy to say.
Yeah.
If it was more difficult to say, I think people would say it less. Mm-hmm. They both kind of flow.
Yeah. So when we took our break, we were talking about elective surgeries, and Josh, you explained that you guys have suspended elective surgeries. Mm-hmm. But two questions I had was, first of all, you spoke about you want to conserve beds in the hospital.
Correct.
How many beds today? And I'm not talking about how many people were in there, but how many beds does the Uniontown Hospital have today that they can use for if an outbreak happens?
Sure. I mean, inpatient beds, we have 154 beds, all private rooms. So all those, basically are there. However, we have to maintain beds for those patients that are inpatients for other reasons.
Right, that are already there.
Right. So we have our ICU, our intensive care unit. It's 14 beds. We have additional beds that can be converted into ICU type beds. And we have taken steps to plan, as we've been talking about for this, mitigation steps. We have converted our second floor to east and south is our COVID rule-out floor. So essentially, if you're tested and you're an inpatient, that's where you're taken, and it's kind of an isolation floor, and we can hold over 20 patients on that floor, and that's what that floor is being utilized. And then we have additional protocols moving forward from that for other floors that could become COVID floors as needed.
So right now, you roughly have 188 spaces available.
There's a lot of space.
Which can be added to
and
if
we have
need
the space in the ED as well.
Right.
So we're, when you look at something like this, you have to prepare and be planning around worst case scenarios. So we're looking at all available space.
Well, and that's what I'm asking. Yeah. Minimum and maximum is what in my brain is what I'm trying to get to.
Right. So we have space available. We have plans available of how to utilize that space to take care of and care for as many patients as we could. Absolutely.
Okay. Now, the second question I had was you talked about elective surgeries being postponed or canceled, but what about I come in, I'm in a car accident, I break my leg.
Right.
I need surgery immediately on that leg.
Absolutely. So emergency surgeries that cannot wait, surgeries that are for patients, with illness or disease that has to be addressed immediately. All those things are still taking place. Our surgeons are still working, still functioning to cover all those aspects. It's just elimination of those elective type procedures that can be put on hold for a short period of time and not incur any damage or harm the patient in any way.
All right, let's talk about the hours and the patient screenings.
Right.
How have those been affected?
So we have, and again, and this is all in an effort to attempt to keep the site as clean as possible and maintain the safety for our employees. We have reduced hours at both our outpatient diagnostic center as well as at the hospital. So patients are still coming in for tests. Tests still need to be run. We're one of the primary places where you can get those tests taken care of. So we recognize that. So they're still coming in.
Okay, so wait.
Yes.
Test meaning?
Diagnostic tests, x-ray, blood work.
Okay, but you're not doing COVID testing at those two locations?
No.
Okay.
So I'm glad you made that. Yes.
Because you're talking testing. I need to
medical testing that is not related to COVID.
Basic routine
tests.
Lab work that you would get, or x-rays that you would
X-rays,
need.
MRI, mammograms, anything that is a test that people need that they would typically come to the hospital for that service, not COVID related.
That they would get a prescription from their medic, from their PCP or the hospital.
That's right.
The ER doctor and say, go get this test done.
Right. So we're still doing those things at the ODC and also at the hospital, but both places have
ODC.
Outpatient Diagnostic Center,
which is over off of
it's
Wayland
Mary
Smith,
Higgins.
Mary Higgins over by in front
by
of
Walmart.
By Walmart. Okay.
Yep, blue roof.
The blue roof.
That's what they call it.
I know why. It is.
Yeah, I know.
But no, and I wanted to clarify that because we don't want people going to those two facilities thinking they're going to get a COVID-19 test.
Right. We're going to go over that specifically.
And we'll get to that. But
in depth. Yeah.
I want to put it out there early.
Right. So this is for patients that are coming in for that routine work that would normally be done when it's not COVID time. Those things are still being done at both those sites. The hours at the hospital are 6 a.m. to 6 p.m. Monday through Friday, and then on Saturdays from 6:30 to noon. And no testing on Sundays, obviously, unless you were an emergency patient, and then you would be tested through the emergency department. At the ODC, the testing is from 6 a.m. until 2:30 p.m. Monday through Friday.
No weekends at the ODC?
No weekends at the ODC at this time.
Okay.
And when it comes to the screening process, people coming to the hospital at this time are going to notice new protocols that they're not used to. They would be able to just walk into either the ODC or the hospital to get their test. Now there are people kind of waiting for them to welcome them, ask them what they're there for, check on whether they have symptoms, and then admit them either with a mask or without, depending on what the case may be.
And where they're going.
And what they're here for, right, exactly.
And this is just a question, are they also taking them to that location? Like, for instance, if I go to the hospital and I'm doing blood work.
Yeah, it depends.
Are you having somebody walk me there?
It depends. So if we have, if patients don't know where to go, we have several runners that are available that are kind of doing that. A lot of patients, it's a routine. They have a good sense of where to go. So, we allow them to enter and go as normal.
All right. So let's talk about the emergency room and emergency department. You keep saying ED.
Yeah.
And I'm not trying to beat you up here, but we got to get into the routine of telling people what what your terms are.
So it becomes second nature.
Well, it has to be. When I work for the city, it's the same thing. I mean, I use more acronyms than I do anything.
Sure.
Because that's the nature of the business.
Right.
But the emergency department, or ED, what are the hours? What about triage? What about pre-triage? What about, can I just walk in and say, okay, I'm here?
Yeah. So I'll give you the whole breakdown. Yeah. So our emergency department is 24/7. The emergency department does not close.
And I knew that, but
I know you teed that one up for me. I appreciate it.
I wanted to give you an easy one.
So and as we've talked before, outside of COVID time, our emergency department is one of the busiest in the state. We average anywhere between 50 and 55,000 patients through our emergency department a year. It's an exceptional crew. It is an exceptional crew.
It is, and they do a great job.
They do.
Without COVID.
So now you've added a new layer of challenge to them, and all they do is continue to rise to the challenge, just like everybody at the hospital. I'm very blessed to work with all of them. But what we have done is we've set up an outer waiting area, essentially. Not a waiting area, but a reception area. So when you first come through the emergency department entrance, there's going to be a nurse stationed right there at a desk. And she's going to run through a small list of questions and screen you, take your temperature. And at that point, she's going to route you one of three ways. You're going to, if you come in and you've got, a cut on your arm or you're holding your arm because you broke it, you're going to be sent right into the waiting area just like you normally would be to be taken care of and to be assessed and taken back to a room. If you come in and you have respiratory distress or certain symptoms associated with COVID-19, you will then be taken to the triage trailer, which we set up on the outside of the emergency department. This is in conjunction and with the help of the Fayette County Emergency Management Agency. They were awesome. They got us the trailer in advance. We outfitted it with everything we need. We reverse pressurized the air in it, so it's kicking out the old air and bringing in new air the entire time. And
so it's keeping it as clean as atmosphere as possible.
Exactly. So that's where those patients would be then taken to be evaluated. And the third case, the third pathway would be if you show up and you have emergent level of COVID symptoms, you need care immediately, you would be taken in through the ambulance bay, down a specific hallway to a COVID area that we have segmented from the rest of the ED emergency department.
Well, I think we got that now.
All right.
But the nice thing about it is your emergency department was already set up in sections.
Yes.
So it was not. There was no major construction that you guys had to do.
No.
To and I don't want to use the word quarantine. But I'm going to say to segment.
Right. It's isolation.
Isolate from the people who are coming to the ED.
Right. That's the goal. Is you're right. You're now saying my words.
I know.
But the goal is I don't want to stigmatize patients either. And I think that we run the risk of that sometimes with situations like this. The COVID patients are just like any other patient. They don't feel well. They're in need of emergency care. So even though we're isolating them, we're going to give them the same level of care and treatment and attention as everybody else that's in there. So, while there's a lot of fear in the community, people don't need to just be afraid. They're being isolated by the professionals who know how to isolate them, right, who are using the proper equipment to make sure that they're treating them safely, not spreading that virus if it's there to other people, and in all instances, when patients come to the ED, we don't know if they're COVID positive or not, right, and that's why I told you that the floor we established is a COVID rule-out floor, because to this point, until
you test me and you get the results,
right,
which. Do you know the answer to this question? How long does it take to get results?
So it's changed. It's been quite a journey, much like everything else through this. Initially, when we first started running tests, we were looking at 4 or 5 days to get returns on testing. By the end of last week, that was down to about 2 to 3. By today, it's less than 24 hours typically.
Well, that's
and
awesome.
It's going to keep getting better.
Because I know, like when I went to the doctor with the flu symptoms, mm-hmm, which I did have the flu.
Yeah.
It was like they walked in, swabbed me, walked out. Next thing I know, there were 4 people in my room with masks on. Go, put this on.
Yeah.
So it was like within seconds, minutes.
Right.
But this takes a little bit longer.
It does.
So that's why you have the floor that you could take them to.
Right. Keep them safe.
Basically keep them safe, but put them in a semi-isolated area, mm-hmm, until you can determine. Right. And if they're determined not to have it, then you can move them to another area.
We can move them to another floor, discharge them if they're healthy enough to be discharged with the proper precautions, all those type of things. So, yeah, we have a lot of protocols in place.
All right. Let's take a quick commercial break. When we come back, I want to talk about your off-campus testing areas.
Okay.
You're listening to What's on Your Mind right here on WMBS Uniontown.
WMBS.
And we're back here on WMBS with Josh Kryzak, the Director of Community Relations for the Uniontown Hospital. We are talking COVID-19. We're going to talk right up until the top of the hour. Then when we come back in the second hour, we have a guest going to be calling in. So Let's get to it, Josh. Off-campus testing.
Right. So the demand for testing continued to rise locally as it did around the state and around the country. We recognize the need to try to help people get tested. We were able to partner with multiple people. Specific thanks go out to Jason Foster. He is the owner of what used to be the Kmart site in South Union Township. Thanks to the South Union Township supervisors, and again, also thanks to the Fayette County Emergency Management Agency, who helped us a lot. We were able to establish very quickly an off-site testing facility in the parking lot of the old Kmart. It was up and running as of 10 a.m. on Monday. It is a drive-through facility. Prescription is required. That's the most important piece. We do turn away probably about 50% of people that show up, so we end up having about 50% with prescriptions and 50% that do not. So we had communication with area physicians, our physicians, as well as others in the community, letting them know that we hope that they follow CDC and Department of Health recommendations as far as providing those scripts. But then once they come up, they provide that script. Either it's called in, or they provide it by hand. They run through a test there, and they're swabbed there, and we're getting those results back quickly now this week. So that's been up and running. Today's the third day it's been up. The numbers have continued to rise. All told, over the course of the last week, we've tested more than 150 patients. And so when you think about that, and we think about what we said, earlier towards the top of the hour, we have the 3 positive results. We have many that are outstanding, but we have many, many more that have come back negative, dozens and dozens.
Well, and that's the good thing.
That is the good thing.
That's the good thing.
Yes.
And that's what I was going to say. It's nice that you guys set this up.
Right.
But it's also good. You don't have to be tested just because you want to get tested.
Right.
There's a reason to be tested, not, hey, I'm going to swing by and get tested.
Right.
That's not how this works.
No. So, and I think that's, some of the hysteria and concern out there. People think that that's part of how it's going to work. Maybe it'll eventually be there. We've seen the discussions about self-testing that might eventually happen and stuff like that. Right now, this is what we have available for the local community. We feel confident that it'll capture the people that need to be tested. We also feel confident that we can rely on our partners in the medical field to give their best judgment and make sure that the people that need to be tested are the ones that are being tested.
When you say local community, you really mean the national community, because every hospital is doing the same test.
That's right.
Every medical provider that's testing is doing the same test. There's not a secret test out there that Mark Rafel Medical Facilities is doing that nobody else is doing.
Right.
And there's not people walking around knocking on doors saying, hey, let me test you for COVID-19. That's not happening.
Right.
So we need to tell people that, because you're seeing that more and more too, where people are just, we're here. No, don't. If you don't feel sick, you don't need tested.
That's right. If you don't feel sick, the keys for those people that don't feel sick are the people that are not in the high susceptibility or concern range, is to follow the things that they're hearing on the news every day. We all live in a different world now. There's no restaurant to go to. There's no bar to go to. There's no movie theater to go to. There's no contemporaneous shopping to be done. Things aren't happening the way they used to happen.
No.
So what people now are doing is they're focusing on this basically 24/7. A lot of them are not working, and that increases and raises that fear level and that concern level. The people that are healthy, the people that don't have symptoms, they should proceed in their lives with caution, but not fear. They should be going out. They can go for a walk, with their family. You can, go to the grocery store and be careful. Isolate as much as possible, avoid large groups, wash your hands as much as possible. You don't have to be in there washing your hands every 5 minutes, but washing your hands routinely and regularly. These are the ways that you help to combat the spread.
But you do wash your hands every 5 minutes if you're out at the grocery store.
Well, that's different.
If you open your front door, check your mail.
That's right.
Wash your hands then.
That's right.
And I got to say this, that's what I've done all my life. Mm-hmm. And actually, we did, when I worked for Kingfish years ago, I'm going to say 9 years ago when the bird flu was out.
Mm-hmm.
I did videos for them, and the tagline was, listen to your mother and wash your hands.
I like that.
And that's the key to this whole thing. And just like when you're out walking, keep a distance. If you got to go to the grocery store, keep that distance. It's not that hard to do.
Those are all ways to take charge and to do your part to help flatten the curve, to help protect your neighbor, to protect yourself, to protect your family. And you're absolutely right about washing hands. When you start to think about it and keep it in the front of your mind rather than the back of your mind, and you think about touch points, when the touch points occur, wash your hands afterwards.
Yeah.
If you grab a doorknob, if you pick up your keys and drive, and you're driving, your hands are on the steering wheel. When you're out of the car, wash your hands. When you've went to the grocery store, when you've pumped gas, all those things are times when if you start to think about it consciously, you'll think, okay, yeah, I did. I just touched something that other people touch routinely. I don't know what was on it. I should wash my hands. If you take those steps, they can go a long way to helping to reduce the potential spread.
It's just like when you walked in today. Normally, you and I would shake hands, hug each other.
We'd hug.
Right, we'd hug. Today is, hey, what's up?
I know.
And then I opened the door, I locked the door, and I walked over. On the desk out there is hand sanitizer. I put some hand sanitizer. When I get in my car, I have my little bottle of Uniontown Hospital's hand sanitizer that I received at the Story Square Summer Concert Series. That was just a bad plug, Bill. Really, it was. That's still going to happen this year.
I hope so.
We hope, as long as this doesn't take over.
Right.
But those are the things that you do. Keep a bottle of hand sanitizer. So when you pump gas, use it. I've done that for years because my OCD tells me I have to. and I still hear that voice in the back of my head of my mother going, "Did you wash your hands? Did you wash your hands? Go wash your hands before you eat."
Right. That's absolutely
I'm in my own house, and before I sit down to dinner,
picking things up.
I wash my hands.
Things.
I'm laying on the couch. My clothes may have that virus on them. I get off the couch. I wash my hands. So yes, you do wash your hands a lot. You do have to take care of yourself. You do have to keep the social distance from people. Mm-hmm. Those are all ways that we can help each other. We can help keep the curve down, and I just hope people remember it 9 months from now.
Right. Those are things that are good to practice on a routine basis anyway.
Right.
Not the social distancing necessarily.
No.
Being social, being around friends, having that touch, that interaction is very important. And that's one of the things that has made this much more difficult than people anticipated. I heard it brought up this way, and it was very interesting. The greatest generation in World War II, they all came together to make this happen. Different times in history, people come together to make it happen, and that's why you see the hashtag alone together. This is different. We are coming together, but we're doing it individually. And I think that there will be a time when this will start to fade out and phase out, and I think that this is your chance to really make a difference by maintaining that social distance and by being alone together. And like you said, the elbow bump, the tap of the shoe, the wave. There's a lot of ways to say hi.
Hey, what's up?
Without doing the traditional ways.
All right, you're listening to What's on Your Mind right here on WMBS Uniontown. We'll be back at 2:15 with Josh also in the room, and we will have on the phone with us Dr. Serby Gower. She is going to talk to us. WMBS Uniontown. Listening to What's on Your Mind right here on WMBS Uniontown. This is Mark Rafel. We are here today being brought to you we're also here on South Union Township Network. We're being brought to you in part by Caldwell Bankers Law, Ridge Realty, Chestnut Ridge Counseling, Davis & Davis Attorneys at Law, Southwestern Gastrointestinal Specialists, Mountain Creek Construction, Sisson Pre-Owned Vehicles, Baker Chiropractic, Jacqueline Fine Jewelers, My Tree Medical, and of course the Uniontown Hospital. And I saved them for last because Josh is in the studio with us, and we are here talking about COVID-19. Josh, welcome back.
Thank you, Mark.
Do I have to give your title again?
No, it's okay.
All right. And also on the phone, we want to bring her on right now, Dr. Serby Gower. She is the Chief Medical Officer at the Uniontown Hospital. Dr. Gower, can you hear me?
I can. How you guys doing?
Good. We appreciate you practicing social distancing for us. You took it to the extreme, though, Doc. I just want you to know.
Josh just didn't want me in there.
No, that's not true. No, so
Competition.
That's
is that right?
Competition.
Well,
And I agree with you, Doc, because I know how he is.
Here we go.
He has to have all the attention.
So
That's right.
I had my hour, so now this is your hour, Serby. It's your time to shine. But honestly, in all honesty, we had a very good first hour talking about a lot of the things that we've been doing at the hospital, and just kind of discussing COVID-19 in general. But one of the things we kind of previewed is we're excited to be able to offer up your expertise to the community, just to talk about some of the things from a clinical perspective that you see, and what we can maybe expect moving forward. So Mark and I are going to work through some questions for you, and we'll see where we go.
Before
Sounds great.
we get too deep into the questions, can you just give us a little bit of your background, what your
Sure.
specialties are, where you came from, and how much you love the Uniontown Hospital?
All good questions. Yes, I can do that. So I'm actually a native of the South Hills of Pittsburgh. I grew up in Dormont, actually, and then Bethel Park, South Hills. And then I've been around. I went to college in New England. I got my medical degree from Temple in Philadelphia. I trained at Cooper Hospital, which is in South Jersey, really just out of Philly. And then I moved back to Pittsburgh. I am married with 2 kids, and my husband's from Central PA. So I made him come out to Western PA so we could have children. My mom could raise them.
and you showed him what a beautiful area Southwestern PA is.
That's right. And I was lucky that he didn't really have huge football loyalty. So I was kind of able to quickly convert him and have him adjust to being in Southwestern Pennsylvania. So that worked out well.
That's a good thing.
When we moved back, we lived in the city, and I was a staff physician at Jefferson in Pleasant Hills for 5 years. And then I was fortunate enough to come here to Uniontown to be director of the ED in fall of 2016. And then about 2 years after that, I was asked to become chief medical officer for our hospital. And so I am trained and boarded in emergency medicine, and that is where we are.
And now you're enthralled in the COVID-19.
Yes, and now apparently I'm also a public health expert and all sorts of other things I think I could throw on to my title.
Absolutely.
Just remember, these are all resume builders.
That's right, and we have to wear many hats, as you know.
Radio
right.
personality.
Or many masks.
Well, that's a good one.
That's right.
there.
That's true.
So I want you to, and I'm going to ask you to start real basic with me.
Sure.
Because, I've watched enough news and I've watched enough social media, read enough social media, gotten about 7,422 emails just this week.
Oh, is that all?
Yeah, just this week about COVID-19. But can you tell me in basic layman terms, what is it?
Well, let's talk a little bit about the other name it goes by, which is coronavirus.
Okay.
And that's important because, now, I'll be honest, I took microbiology a long time ago as a first-year medical student. But if I remember correctly, the common cold circulates a lot as one of the coronaviruses. Not the one we're dealing with right now, that's COVID-19, but the generic family falls under that coronavirus. There's also rhinovirus, which is very common, also causes colds and sniffles and the like. But this, as you may, since you're such an avid consumer of internet and social media, you've probably seen the word novel stuck in front of it several times,
Yes.
the novel coronavirus or COVID-19. And that's it's just what it sounds like. It's just a different type of coronavirus. It's a strain that we haven't seen before. And while it probably is rightfully categorized in the coronavirus family, it just has certain qualities about it that I think scientists are still working through as to what makes it so highly contagious and seemingly relatively lethal, and very quickly spread at a certain intensity. So, no, I'm no microbiologist, but I can tell you that it falls roughly in that family. It's kind of interesting because, we can run tests on coronaviruses. We have been able to do that for years, but this test, the tests that we need for this are different from the ones that we've done before. So it wasn't surprising a year ago to be positive for a coronavirus. Fine, you're positive. That basically means you have a cold, confirmed. That's nothing that, as an ER doc, we wouldn't even run those because it's the type of test that takes several hours, maybe a day to run. And it was kind of a moot point because you'd say, great, we thought you had a cold and now you do. But this one is obviously different or novel, and that's why it's called what it is. The 19, it probably comes from some molecular
or some guy
background.
just said, let's put a number 19 at the end of it.
Right.
And we've seen, I mean, for 30 years, Lysol has right on their bottle, kills COVID, or kills corona, kills the coronavirus. Mm-hmm. So it's not like this is something that just miraculously appeared overnight.
It's this strain.
It's this strain in this one deal. So tell me, how is this different from the flu?
No, you know what it's like. It's like finally your daughter, she brings home a different boyfriend every other month, and now she brings home this guy.
I was that guy.
Oh, that's too good.
I said we were going to be serious.
And now you don't know how to get rid of this
I know,
stuff.
right? See, now listen, so let's just take
digressed.
a little segue here. A little sidebar. Mark and I, we tried to be exceptionally serious in the first hour, and he and I typically aren't serious, and now we have you, and it's going off the rails.
Yeah, just to let you know. So thank you for that. So tell me the difference between COVID-19 or coronavirus and the flu.
So you said COVID-19, coronavirus, and the flu. Okay, yeah. So interestingly, not that different. I have been saying a lot that influenza, although that is technically a separate family of viruses, but influenza would look like this all the time if most of us didn't vaccinate. So to all the people out there who disagree with vaccination, have their concerns, I will just say that we would probably be in this predicament or close to it year after year if the majority of us didn't get flu vaccines. And that's what's making it so hard to combat this, because we are vulnerable. We are not vaccinated. Again, I'm not an infectious disease doc, and I'm not a microbiologist, but I do believe that part of the reason that we're having problems with this is because it's a disease that has apparently jumped species, right? So all coronaviruses and COVID-19 are similar to, if you remember, SARS from several years ago, or MERS, which is Middle Eastern. I'm going to screw up the last one, but I thought it was Middle Eastern Respiratory Syndrome. Those are all in the same family. But those were actually, and the data on this is really hard to get, but SARS and MERS were pretty, they had in some ways higher fatality rates, but they didn't seem to have the vast spread that COVID-19 has had. So this, truly jumping across continent to continent, if you reflect on the news over the course of the last several months, we were hearing about this in Asia and China before the holidays, right?
Right. Mm-hmm.
And then all last month, it was Italy became the epicenter. And now we're looking at the North American epicenters, which are New York and Washington, maybe now New York more than ever. So it's just, while they share a lot of characteristics, there's no, the things that are different about these viruses is how quickly they can spread, and also how lethal they are once you get them. If you break down by age groups, it's very different. Mostly, you're looking at 30-somethings would fare better than an 85-year-old with COVID-19. But the scary thing is, as we're marching ahead in this sometimes which seems like a surreal journey through a sci-fi novel, we are seeing more and more younger people getting sick with it. So, that's what separates this. I think it's taking all comers. I also wonder, and this is speculation, but I also think about how much the world has changed in terms of our connectivity and travel, even in the last 10 years. I was a resident when H1N1 swine flu was taking over our localities. And I worked at a tertiary care center at the time because I was training. And I remember it differently. I don't know if that's because I was just seeing sicker people because I was at a higher acuity facility, but it's just interesting to me because I wonder, how much travel has increased and how much travel for business purposes as well as for leisure really taken off in the last 10 years, right? I mean, it's so easy now to book a flight online and go several places, and the travel industry has really benefited from, it's easy to you can book tours in far-flung places that you may never have gone. I just think that the world in some ways has gotten smaller, but that's another way of looking at it, that I just wonder how much of this is a product of our lives and our living. And it's ironic because it's that mobility and it's that ease with which we move through our world that has now come to a grinding halt, right? Mm-hmm. So it's just interesting to me. This virus has really just taken on, it's got its own persona. It's got a life of its own, literally. So I just find that very interesting. I don't remember feeling that way with SARS or MERS or swine flu or any of those, or plain influenza for that matter.
Right. Well, how is this spread? How is this disease spread, or this infection, the COVID-19? I'm stammering and stuttering like I never did before because it's such the information.
Complex.
Well, the problem is it's so complex. You got to figure this out. So tell me how it's spread.
It spreads easily. It's spread primarily by droplets. And what does that mean? Or we can talk about the difference between droplet and airborne, which you may hear or read that a lot. Is this airborne spread? Are we practicing droplet precautions? What does that really mean? So if I'm in a room next to you and I have a virus that spreads by droplet, I sneeze, and within that droplet of, this is lovely, in that droplet of my saliva, spit, whatever, mucus that I sneeze out, resides this virus. Now, you've got to get that droplet into your mouth, in through your eyes, up through your nose, to get the virus from me. There's some in-between steps there, too. So if I sneeze on my hand, shake your hand, and then you put your hand up to your mouth, in theory, you can take the droplets up like that. But that's how colds spread, right? I mean, that shouldn't surprise you.
Mm-hmm.
And that's pretty much what this does. There's differing opinions out there. I've heard people call this when we talk about how to protect ourselves, we talk about, it's modified droplet. People really make careers out of talking about if this is a large droplet or a small droplet problem. Obviously, smaller droplets are more concerning because that means that it takes very little to get this in. And there might be, given that this is so rampant, maybe there's reason to believe that. When you start really believing that smaller droplets are involved, people start wondering, well, then do we have to worry that it's in the air? Something that I told you my husband's a physician. Something that we joke about is the air is not contaminated. Like, I don't want people walking around being like, there's people in our community or in our world that have this virus. The air is now contaminated. It doesn't really work like that.
And it's blowing, and the air is coming from Asia, and it blows over the United States, so we get it too, right?
Right, exactly. No, that's not how it works, and I can understand how people get worried, but that's not realistic. So if something is really, truly airborne, there's greater concern that it lives on surfaces longer, because the idea is that it's in this closed room, let's say, and it's in the air, and it's going to float down. Eventually, gravity will take over, and it could land on the surface. And how long is it really alive and viable? But that's for viruses that don't need that. Think of the droplet as like a house. They don't need the house for that.
Right.
So those are even more concerning because they can just be more prevalent in that atmosphere, in that space, whatever space we're talking about. So, but this is we're CDC and the scientific community is operating on the assumption that this is passed by droplets. Very likely, smaller droplets can pass this virus, but that would make sense because then it doesn't take that much to spread this from person to person.
Right, which is why the spread has been rapid, and why there's concern about how much the spread can eventually encompass.
Right.
Okay, let's do this. We're going to take a quick commercial break. Stay on the line, Doc, because when we come back, I got a couple questions about this spreading and these droplets. So we'll be back after these messages from our sponsors. This is What's on Your Mind right here on WMBS Uniontown.
WMBS.
You're listening to What's on Your Mind right here on WMBS Uniontown. On the phone with us, we have Dr. Gower from the Uniontown Hospital. She's the Chief Medical Officer, and that sounds so official. I feel honored to speak to someone with such an awesome title.
I know. She's very official.
She's doing a great job. She's giving us a lot of good information and keeping it on a level that if I can understand it, I'm sure that 99.9% of our listeners can understand.
Right, and I think that's important. I think that a lot of times when it comes to the clinical side of things, they can get lost in the weeds, and we really want them to have a grasp of what we're talking about.
So, Doc, let me ask this.
Yes.
What should we anticipate locally in the, and I know it's hard for you to come up with this answer because these things are changing not by the day, not by the week, but almost by the every 15 minutes. So what should we as Fayette County residents, as citizens of this community, anticipate within the next 2 weeks? Let's start there.
That's the million-dollar question. And it is difficult to answer, but a lot of it depends on our community and everyone's individual response, and probably what guidance we're getting from our government at the state and the federal levels. So I think so far we have been lucky. We have not entered this phase of the pandemic with the same gusto, I guess, for lack of a better word, that they faced in Washington State or New York City. I do, again, wonder if part of that is metropolitan Pittsburgh is still smaller than greater Philadelphia and certainly the New York City area, for instance. That's not to say that people aren't worldly and don't travel, but it's just a smaller, less dense population that may be helping. We also are kind of in the, almost the fourth phase of this. So, the world saw China go through this first. Then we saw Europe and particularly Italy. Third wave, I would say, was these epicenters domestically, California, Washington, New York. So, if it comes to us here in the Mid-Atlantic or Midwest or Northern South, however you want to characterize where we live, I think, we're lucky because we've seen the other three and we've had the most time to prepare.
And the other three are more dense communities and more dense areas. There's more people living in a 1 mile square than there is here.
Yes. And, I have everyone that asks me, I tell them, I say, I'm optimistic and I want to be an oasis, which might not be reasonable, but we have some things going for us in terms of, like you said, the geographic layout, and our lower nominal population, definitely lower population density. We also, the states closed down schools on March 13th, and it's not so much that it's not just that kids going to school was problematic. It's just that, as you noticed, a lot of things slowed down with that. So I have a 7-year-old and a 4-year-old, and they're not going to gymnastics, and they're not going to dance class, they're not going to soccer, and they're not going to tennis, and they're not going to their friends' houses either. And I will say that at least, I live in the South Hills of Pittsburgh, and I will say that my immediate community has been very good about exercising that social distancing. And I feel that for a large part we have too here in Uniontown and Fayette County, and that's really meaningful. All those encounters are exponential. So every little thing that we do where we limit our interactions or goings and comings is really valuable. So we might be lucky in that we've had time, we've learned from the other three waves, and we have some demographic features which bode well for us. I kept saying that this whole month, if we got through the end of March, it would be very telling. And we still got a couple of days to go. So if I'm right, all the days run together. But I think today's March 25th.
Yeah, this has been the longest first day of January I've ever lived in my entire life.
That's right.
So
Exactly.
I understand that. I have a question, and maybe you can answer it, because you used the word pandemic, and I had this question asked of me, and I didn't have an answer. What's the difference between a pandemic and an epidemic?
And I might screw this up too.
That's
but
all right, 'cause
pandemic means that it's just being spread, so it's widely spread. So
Okay.
it's spread. We typically, I think, would use that. I think you could use it for a country's worth, but I would say in this case, and the way we're using it is just across the world. But an epidemic is just a smaller community.
Okay, thank you.
You can
'cause-
think of it that way.
And that's
And
what
I think it's worth noting that when people say pandemic, I think, and there's going to be epidemiologists that call in and say otherwise, but
we're not taking calls, so
we're not taking calls. But a pandemic doesn't necessarily mean or give any indication of how lethal something is. It's simply numbers. It's simply saying that there is a disease. The same disease has now swept through large swaths of the globe.
Right.
Okay, so-
You're absolutely right. So in my research too, one of the key identifiers between the two is pandemic it has a relationship with geographical spread.
Okay, and I'm glad, and I forgot to look for myself. And when you
Shame
said,
on you, Mark.
I know, but she said pandemic, and it reminded me to ask that question.
I'm glad you did.
So let's talk about some things like the Department of Health and CDC recommendations. What do you? And again, I work for the city of Uniontown in my regular job, so I get a lot of emails from the Department of Health and the CDC and the governor, and it's just overwhelming stuff. And every 10 minutes it's another email, and I could sit there and read it all day, and by the time I'm done, my head hurts because I don't know where to go. I don't know what to, and I don't want to say what to believe and what not to believe, but what I'm supposed to be concerned with. So maybe you can corral whatever you've got and say, okay, the Department of Health and the CDC, these are the main, and I don't want to say 5 because I don't want to limit it to that, but these are the main things that they feel that we need to be concerned and what to do about this. Am I making sense to you?
You want to know what we should be doing to prevent the spread, or doing if we think we're infected?
Let's start with the spread first.
Yep, and then we'll go to
Okay.
infected.
And then we're going to go to infected.
You're perfect. That's exactly what we want.
So I guess I asked 2 questions in one, which I'm
You
really
did.
good.
So
Wow.
we'll start with spread.
Yes, let's do the spread.
What are those recommendations that you see as significant from those agencies, and your recommendations for people to take as far as helping reduce their footprint and trying to corral that spread?
So, to quote a pretty poignant article that came out within the last month, probably the last 2 weeks, cancel everything. So I think it's really, really important to leave your house for the bare bones. Those of us who work in healthcare and maybe other essential governmental functions or societal functions, we have to go to work. But what we don't need to do is, and I think we are accomplishing this because of our state government, which has rightfully shut all the non-essential businesses down, but that's really meaningful. So we forget that we're so used to being mobile and going wherever we want, whenever we want. Walmart's was open 24 hours a day last month. But all those, like I said, all these unnecessary trips and contacts are harmful. Mm-hmm. So social distancing is not just something the kids are doing. It's actually worth following. I myself, I still come into work as a physician and a leader at this hospital, but it's really interesting to me how I really don't do anything else, right? So that's it. I drive from Peters Township to Uniontown Hospital and then pretty much back, but I think that's meaningful because my prior life was like I said, run to dance and gymnastics and everywhere in between. And I'm just thinking about how many hand-to-hand contacts I have. All the things that sound corny, but wash your hands, cough into your elbow, all those things really do matter. We talked in the beginning of the hour about droplet spread, and that's exactly what droplets want. They want to leach out onto your hands and surfaces and have other people touch them, and that not doing those things is meaningful. It's funny because we want there to be, as Americans and as humans in the 21st century, I think we want there to be a cure, and we want it to come in the form of a pill or a device, and it's just not going to, at least not for the foreseeable future. And so all the preventative measures that you learned in kindergarten still apply. So as I've told my toddlers when they were toddlers, don't bite your friends. Like, all these things are still things that we can do, and there's not much more to it. I have to, I think that's on a personal level, and then I'm glad that we don't have non-essential businesses up and running right now, because I think it's hard and it sends mixed messages to people to think, well, it's open, so I could probably just utilize that, or I'm just going to go in and out, but you just touched that doorknob, and so did 50 other people. So on a bigger level, I think government agencies and other bodies who are saying, you know what, we're just going to close this because it's hard to tell people that they don't need to be places. It's hard to tell people and leave those things open and just expect them to use them when they absolutely have to. So those are the two big things: social distancing and hygiene. Lesser things, perhaps, just being cognizant of the people in your world. So your elderly relatives, anybody that's immunocompromised. My parents live 10 minutes from me, and they're a big part of my life and my children's life. But they're FaceTiming with my girls, and they're young. They're in their early 60s. But still, and they're healthy, but still, I'm just trying to be conscious and socially responsible. I think never before has it mattered so much to be a good person. And I know that sounds silly.
That's the truth.
But never before has it been more meaningful to do all that you can do to stem the spread of this virus. Because it's simple things that a good person would do that we're asking everyone to do.
And it's funny that you say that, because one of our inside jokes, you and I, on a regular basis, is about being good humans. And, I think that this is everybody's opportunity, regardless of what they do, to take the steps that they can to be a good human.
We're going to take another quick break, but when we come back, and I'm going to give you time to think about this answer, what are you doing as a medical professional when you walk in your house to protect your two daughters? So think about that. When we come back, I want you to answer that. You're listening to What's on Your Mind right here on WMBS Uniontown. You're listening to What's on Your Mind right here on WMBS Uniontown. COVID-19 information by the Uniontown Hospital. I got to say, my brain's in overload.
There's a lot.
But it's good overload, because
Absolutely.
It's taken all the craziness from the news media, from social media, and you guys have brought me to a point where I'm concerned, but I'm not ready to go to Brownsville yet and jump
That's
off the
good.
bridge.
That bridge, I don't want you on that bridge,
Right.
Mark.
But the problem is, with all the hype and all the social media fantasies and realities, you don't know what is, you can't sort through it. So it's great to have first you here for the first hour, but more importantly, I wish she was in the studio, Dr. Gower, so that we could ask her even questions off the air, because that's when I get all my answers that I really need to know. Yeah.
No, I mean,
but
she's a wealth of knowledge.
So Dr. Gower, when we left, I asked you, as a medical professional, and I'm asking this not just because you being a medical professional, but me working in government, in a government building with 12 other people right now, if one of them may have it, I need to know what I got to do when I go home to take care of myself and my family. So what do you do when you pull in from that drive and you pull in the garage? What do you do to protect your kids and your husband?
Try to leave my shoes at the garage or right in the mudroom. But there's really, so to be fair, most days I don't work clinically. So those days when I'm just in regular clothes, there's not much more I can do besides not touch my kids. They want to jump on me the minute I come home, but I guess we can't. Mm-hmm. And I kind of scurry through, go right upstairs, and change and wash hands. And that's all you can really do. Mm-hmm. There's no magic soap. There's no spray. There's not much you can do with that. I can speak for our ED that for clinical shifts now, we're able to give the physicians and nurses and most of the staff scrubs, hospital-issued scrubs that they can change into, which is profoundly helpful, so that we can leave that here and just wear clean clothes in and out of our homes.
Nice.
But the truth is, I realize that my kids probably face an increased risk more than other people's kids whose parents don't work in healthcare.
Mm-hmm. Right.
And that's not unique to me. That's unique to all of our hospital employees, and particularly our nurses and other physicians who are taking care of these potential patients. And I think that's really disarming, I think, for a lot of people, because they want to feel like, if I just do this, I won't get it, right?
Right.
If I do everything I'm told and I change and, I'm running in my boxers from the garage up to my room when I get home.
I have a friend whose wife makes him do that. That's why. And he's listening.
I understand. So. And hey, if you can pull it off and there's not a lot of windows in your house, go for it. But it's at the end of the day, that's all you can do.
Right.
And I think you just have to. I think you have to be honest with yourself and ask yourself why you got into medicine. Mm-hmm. I think you have to be honest with your family and your close contacts, and you have to make some sacrifices. I think our families already do that. Our families already know that we go to work on Christmas and that we'll be there on Saturday night. So I don't think that this is that different for them. But that's the best we can do.
Right. So I'm taking the show from Mark for the last couple of minutes here because I have a couple of things I want to make sure we hit. We've got about 5 minutes left. I think that, between the first hour and the second hour, we talked a lot about the importance of the steps that people can take. Social distancing, the steps that the hospital has taken with the triage trailer, the off-site testing, all those things. But there's a couple things I wanted to talk to you specifically about. What do you say is the biggest key? What is the most important takeaway from anybody who's out there listening right now that they can do to help their community? Is it social distancing? Is it something else? What is that takeaway that you want them to have?
Stay home. Really, stay home.
Yeah.
If you have medical knowledge or expertise, we've probably already tapped into that, and we probably already recruited you if we found a need for it. But everyone does their part and takes care of themselves. It may help the greater good. Again, if someone needs your assistance, I know people are close with elderly neighbors or family or people that just have limited means or resources. Again, be a good human. But for the most part, if you have mild symptoms, yes, you may have coronavirus, you may have COVID-19, but you are better off staying at home and working through it until and unless you actually need medical attention to the level, especially of a hospital. That's all we can ask of people. And I think Josh probably talked about flattening the curve and everything in the first hour. Part of the reason we push that is not because we think we're going to eradicate this in 2 weeks or in 4 weeks or in 4 months even. It's just because we're trying to stem the surge. If we can just keep our healthcare system buoyant long enough to handle sick people as they come. I was just in a meeting this morning and I made the analogy that we talk about tuberculosis precautions. We talk about it all the time. It's the one thing that we kind of liken to what we're doing here, just to be ultra secure. But the truth of it is we never get a TB pandemic. You never have more than one patient a year with tuberculosis. You just don't anymore. What makes this hard is potentially everyone coming in at once. So whatever we can do to slow the spread, I should say, is really important. So in short, stay home.
Okay. So two more things. You got like a minute for each. So
okay.
Will it get worse before it gets better?
Possibly.
Okay. So that was quick. See, now you have a lot more time for
She
the last
deferred
question.
her time to the next
She saved the
question.
time for the next question. Possibly, she took a nice political approach there. So my final thoughts are: we've talked a lot about a lot of things, but I don't know. I can speak for myself, and then I would like for you to speak to it too. Over the past 10 days, I have never felt more blessed and more satisfied in the work that I'm doing,
Right.
and working with the people that I'm working with, and
Right.
the fight that we're all facing together. We work with heroes. They wear scrubs. They wear EVS uniforms. They wear nutrition uniforms. They wear suits and ties. The people that we are working with at Uniontown Hospital are heroes. I am proud to work with all of them. I know you
Absolutely.
feel very much the same way, and I wanted to give you an opportunity to say thanks like I am now.
I can't say enough for the staff for this hospital. We do so much here that I think other institutions would be so surprised what we can pull off. It is an amazing group of people. I especially want to highlight Dr. Jeff James, who has been my wingman through all of this. It's guidance like that that's really meaningful, but you're absolutely right. It comes from the top down and the bottom up. Just an amazing group of motivated people, and I would be a tenth of as effective if I didn't have this crew.
Well, I want to thank, and it's wonderful that you're thanking your team and you're in there. But as a citizen of Fayette County, I want to thank you guys for what you are doing, stepping up. And listen, it's real easy to say, I'm going to stay home. I'm going to stay in Peters Township and play with my 2 kids instead of coming to the Uniontown Hospital. But you're taking a chance with your health and your children's health to make sure that my community, and our community, I should say, is going to stay healthy and has the right concept and the right tools for this. So thank you both very much. Thank the Uniontown Hospital. And you're right, Josh. Everyone in that facility is a hero in my mind, and I want to thank them personally. And that will happen when we have our concerts downtown. You're listening to What's on Your Mind right here on WMBS.